my name is Alyssa. I'm a nursing student at Southern New Hampshire University. Today I'm going to be doing a full head-to-toe assessment on you, and this is Ethan, our volunteer. We have already verified his name and date of birth, and you're okay with being videotaped?
Yep.
Okay, great. I have closed the door for our privacy, and I am washing my hands. Good. Okay. So I'm just going to start off at your head. Again, I'm just looking for any lumps, any bumps, any lesions, bruising, any abnormalities at all. Good. Now I'm just going to feel around. As I'm feeling, I note that your hair is evenly distributed. There's no bald spots, any issues there. Okay. Now I'm just moving on down to your eyeballs. I'm looking at the external eye. I'm going to feel your eyelids. Good. Any issues? Any pain at all?
Nope.
Okay. First thing I'm going to do is shine this light at the bridge of your nose. It's just testing for corneal light reflex, which was normal. Now I'm just going to shine the light in your eyes to see that they're reactive to light. Good. Wonderful. Okay, and now what I want you to do is just follow this pen with your eyes as I bring it close to your face. Wonderful. And now I just want you to follow the pen as I move it in an H figure. Wonderful. And your eyes are round and reactive to light, and they are equal and they're symmetrical. I also just want to note that your sclera is white, your irises are green, and your pupils are black and normal. I'm now moving on down to the nose, just looking in normal and symmetrical. I just want you to close one nostril and breathe in and out for me. Good. Good. Great. So now I'm going to do what's called a smelling test on you, where I'm just going to have you smell two objects while you close your eyes so that we can determine if your smelling is normal. Okay, now just close one nostril and smell.
Vanilla.
Great. Okay.
A candle.
Good. Okay, and now we're moving down onto your mouth. Just want you to open your mouth for me. Good. And just looking for any issues in here, any thrush, any whiteness, any issues. Move your tongue up for me and down and side to side. Great. Wonderful. Okay, and now just open your mouth and stick your tongue out and say ah.
Ah.
Good. And now I just want to test your sinuses. You just let me know if you feel any pain, okay? Any pain?
Nope.
Okay, great. So now I'm just looking at your ears. Again, just looking at the external figure, anything issue there. Okay. Good. And now I'm going to do what's called a whisper test. I just want you to block your right ear. I'm going to whisper two words. You tell me what those two words are.
Stick, dog.
Good.
Cat, light.
Wonderful. Okay, and now I'm just going to feel around. I'm going to feel for your lymph nodes, okay?
Mm-hmm.
And just down at your axilla. Good. Any pain with that?
Nope.
And I didn't feel any masses at all, any inflammation at all. Okay, so now I'm going to have you do a couple facial expressions for me. So if you could just lift up your eyebrows and down and close your eyes real tight. Good. And smile and frown and clench your teeth and then puff out your cheeks. Great. Okay, so now I'm going to be moving on to, I'm just going to take a look at your skin all together. Again, your hair is evenly distributed. Your skin is warm, dry, and intact. There's no bruising, no lesions, no issues there, no rashes that I can see. I'm just going to be looking at your fingernails now. They're round and they're clear and they are intact. I'm just going to test your capillary refill. And that was brisk within 3 seconds. Good. And again, on your toes, they are clear and good. And capillary refill was brisk. Okay, now I'm going to be moving on to your respiratory system. So what I'm going to have you do, if you could just sit on this side of the bed with your back facing me. Good. Okay, so what I'm going to be doing is I'm going to be listening to your lung sounds all on your back. But first I just want to go down, feel any issues, any masses, anything. Do you feel any pain at all?
Nope.
Okay, good. And if you could just take a nice deep breath for me. Good. Your chest expansion was symmetrical. And now as I move down, I want you to say the words 99.
99, 99, 99, 99, 99.
Good. Okay. And now I'm going to percuss all throughout your back, okay? Just listening for any abnormal sounds. Good. And now I'm just going to be using my stethoscope to listen at the same time. So what I'm going to have you do is say the words 99 as I go down with the stethoscope.
99, 99, 99, 99, 99, 99, 99, 99.
Great. And now as I move my stethoscope down, I'd like you to take nice deep breaths each time I move it, okay? Okay, great. There was no adventitious sounds. Everything sounded normal. So while I have you turned your back towards me, I'm just going to test for something called CVA tenderness, which is an issue with your kidneys where they're inflamed. You're just going to feel a little push on your back, okay? Any pain at all?
Nope.
Okay, great. No pain?
Nope.
Okay, great. All right, you can face towards me again. I'm just going to do the very similar assessment that I did on your back, now on your front. So again, just feeling around for any issues. Okay, and take a nice deep breath for me. Good, your chest expansion is symmetrical. And again, as I go down, say the words 99.
99, 99, 99.
Good. And now with my stethoscope.
99, 99, 99, 99, 99, 99.
And take nice deep breaths. All right, great. Everything sounded normal, no adventitious sounds at all. Again, I'm just going to percuss the front. Okay, great. So now what I'm going to do is I'm going to listen to your heart sounds. First, I'm just going to palpate your pulses throughout your body, okay? First, I'm going to start up at your head at the temporal pulse. Good, and your carotid. And now your brachial. And your radial. Good. And your popliteal. Your Achilles. Sorry, anterior tibialis. And your dorsalis pedis. Okay. Now I'll be listening. I already tested capillary refill. So now I'll be listening to your heart sounds. I'm going to be listening to both the front and the back of my stethoscope. everything sounded wonderful. And I just want to do the same thing. Listen to your heart sounds with both sides of my stethoscope as you lay on your left side. Alrighty, and all chambers of your heart sounded wonderful. So now what I'm going to have you do is I'm just going to have you lay on your back. Okay. Now I'm just going to listen to the arteries throughout. They're kind of in your stomach area. The first one is your aortic. Aorta. And then your renal. Femoral. And while I'm at your femoral, I totally forgot to check your femoral pulses, so I'm just going to check those now. Good. And good. All right, so now I'm just going to be doing an abdominal assessment. I'm just going to inspect first. So what I'm just looking for, any distension, any masses, any issues. Do you have any pain in your stomach at all?
Nope.
Good, everything looks great. And again, I'm just going to listen with my stethoscope. I'm just listening for bowel sounds. And normally I'd listen for about a minute. Starting in your right lower quadrant. Your vowel sounds are normal, active. Now I'm just going to percuss for any abnormal sounds. And I'm just going to palpate you. Let me know if you feel any pain, okay? Wonderful. Okay, and normally I would also do deep palpation, but I'm not going to do that today. But if I were, I would lift up from your back. This would be feeling for like your liver, your spleen, and your kidneys. I'd lift up on your back and have you inhale, and as you inhale, I would deeply push down about 2 inches to feel for those organs. I'm now just going to test, or just try to measure with my best ability for your liver and your spleen. So what I'm going to do is I'm just going to percuss down the middle of your body to test where your liver is. Starting here. And normally I place a line there, and then I'm going to start again at your umbilicus and go up. And again, I place a line, and that's where your liver is. With your spleen being on your left side, I'd start in the middle and go towards your armpit. And I'm just testing for any splenomegaly, meaning that your spleen is enlarged at all. Okay, so now I'm going to start testing your range of motion. So what I'm going to have you do is I'm going to have you lift up your leg. Good. And your other one. Good. And just push up against me. Good. And against me. Good. And down. Good. And down. Good. And now if you could just bring your right leg out towards me and back in. Good. And move your right leg across your left leg. Good. And same with your left. Wonderful. Okay. And now you can sit on up for me. So now I'm just going to test the range of motion of your neck. So look down and look up and to the right side and to the left side, or either way. And then put your ear down to your shoulder and to the other side. Now if you could just push up against my head, good, and against my head, and good. And now for your shoulders, I just want you to go outwards and inwards, and out to the side. Good. And now just do a nice big shoulder shrug against my resistance. Good. Okay. And now for your arms, I just want you to flex up and down, and I want you to flex up and pull down. Push up against me. Good. And push up against me. Good. Now for your hands, I just want you to flex them down and extend them, and inwards and outwards. And now flex up and down. Good. And now for your knees, if you could just extend them and flex them back in, and then push up against me and again. Good. Now with your feet, I want you to push up and down for plantar dorsiflexion, and push up against me and push down. Good. Now wiggle your toes, curl them. Wonderful. Okay. So now I'm going to do a sharp versus dull test, where I'm going to place these two objects on on different parts of your skin. You just let me know whether you feel sharp or dull. So this is the dull sensation, and this is sharp, okay? All right, close your eyes, good.
Sharp, sharp, dull, 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 sharp, 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 sharp.
Good. Okay. So now I'm just going to do a test called graphesthesia, where I'm going to write a letter in your hand, and you just tell me what that letter is. So close your eyes.
B.
Good.
A.
Okay. And now with your eyes still closed, I'm going to give you two objects. Just want you to tell me what they are.
A pen.
Okay.
And a coin.
Great. Okay, so now what I'm going to have you do is I'm going to have you put your right heel down your left shin. Okay, and on the other side. Good. And now I'm going to have you bring your hand out and with your eyes closed and bring it to your nose. And same with the left. Great. Wonderful. Okay. So now I'm going to have you actually stand up for me. So if you could just close your eyes, I'm just going to assess you for about 20 seconds. All right, great. And now if you could just go towards this side of the room and face me and just walk normally towards me. Good. And turn around and walk heel to toe. Good, and we'll turn around and walk on your tiptoes. Wonderful. And finally walk back on your heels. Okay, great. And you can take a seat again. So now I'm just going to test your memory and your attention span, things like that. So if you could start by counting from 100 to 0 for about 20 seconds, going down by 7.
192, 86, 79, 72.
Good. Okay. And so now we're going to, I'm going to give you 4 words, and you need to remember those 4 words, okay? So it's going to be cat, park, walk, and ball. So cat, park, walk, and ball, okay? So now I want you to count down from 100 to 0 by 20s.
100, 80, 60, 40, 20, 0.
Okay, and now what were those 4 words?
Cat, park, walk, and ball.
Wonderful. Okay, and just tell me what you did last year on your birthday.
I went to the beach.
Okay, and can you tell me your name, where you are right now, and what time it is?
I am Ethan Kerner. I'm in Tewksbury, Massachusetts, and it is nighttime.
Okay, great. And you are alert and oriented times 4. And just a couple more things. I want you to do what it says in this paper, and then we'll go from there. Great, thank you. And think that is all. All right. Thanks again. I appreciate it.
Of course.